Thank you for the opportunity, Dr. Ashish. I'm Ketan Jajal. I'm not a doctor. I'm an engineer. So please bear with me. It will be an engineering perspective that you will have to hear. Uh, But I have been, just to give you a little bit of my background, I'm the founder and CEO of Jajal Medical. We are a 3D printing company. And I've been in this field for last 20 years, focusing on 3D printed implants, working and studied in US and Europe and everywhere. And now we have our own company. My topic is going to be the role of 3D printing in complex arthroplasty. So it's really not just 3D printing, it's really 3D planning that starts with, right? And when you have proper planning, then you have better outcomes. If you don't plan it, you don't get clinical outcomes. You don't want to get stuck intraoperatively. And these solutions kind of help you to plan before you go in the OR so that you don't have any surprises. And all the surprises that you have already had, you're prepared for that. Right? These are some of the complex arthroplasties that we have seen, right? You have shoulders, you have hip, you have knee, your foot and ankle, all these areas. Typically the process is same. You get a CT scan, like the sir was mentioning, right? When you have complexity, it's better that you start with a CT scan, get a 1 millimeter slice thickness. Then the process starts there. You create, using a segmentation, you create a 3D model, right? So this is typically a CT scan, how it would look like. If you have metal artifacts, usually the scan center would have what they call it as an MAR sequence. It's a metal artifact reduction sequence. And if you do that, then your noises are less. Usually you get that. If you don't worry about it. There are still ways to kind of still separate those out. Once you have these things, many a times when you see is that when you receive a 3D CT, it may have a lot of noises and all. So you're not able to see it properly. But that's where the process of segmentation happens. So in segmentation process, there's actually an engineer like me who would go in and manually separate out and say, no, this is femur, this is acetabulum, this is a small piece of osteophyte. All that we separate it out and provide you an exact detailed plan like this and say, okay, this is how the actual patient has, these are the fragments, this is what is there. Now you get a better visualization of what that patient's anatomy look like, right? So the first step is understanding what the anatomy is, right? Once you understand the anatomy, then the plan becomes a little bit easier. So then that's where we kind of help with the preoperative planning, where we help with aligning, say, a cup direction, how you want to place a cup, whether if it's a pelvic discontinuity, what are you going to do? So depending on type of deformity that you see, you may end up either using a standard implant or, either an augment, or all the way, if it's very complex, then what we call it as now a custom biflange instead of a triflange. Customized triflange was used all across the world. The problem we found in Indian patients is that, on the pubic side, when you have that flange, it's very hard to put that implant in. So we modified the triflange and we came up with this biflange, wherein now you have a good fixations, but in pubic side, you still have one screw. You don't need a flange to kind of put that in. So these are some of the examples of the cases here, where you kind of prepare this plan. This is the implant, how it would look like. You put the screws, length of the screws, all that plan is prepared. And then once we have done that, then physically you have this model in your hand, right? So you can understand the patient's anatomy. You can understand what that implant could look like, what that augment could look like. And then you 3D print the implant. And then you use that implant along with your whatever the standard implant that you use. Now, just to give you a little bit, so this is the post-op, how it would look like. These are some recent cases that we have done. One of the good things about this is, because what you have planned, if you are able to execute, your results are phenomenal, right? So here is an example we did in Mumbai. This is a pre-op and this is a post-op. And when you look at the offsets and leg length, they are 0.0. They're 0.2 millimeter difference in the offsets, right? So such results in revision becomes harder, but when you have planned it and you're only executing it, you are able to get such results, right? There's also recently we launched this Bose CCD augment together with Dr. Vijay Bose, where when you have a tricolumnar fixation with 2B type of deformity, then these kind of augments really are designed for that patient. So, you get a custom augment to fit so it's like, you're not cutting the bone to fit the implant that is there. Instead, we're doing the other way, right? You're making the implant that fits the patient's bone, right? So it's a different philosophy in a way. right? So these are some examples of how they are. Then, now the porous structures in the 3D printing is there. This is one example of a tricalium porous structure. So this allows osseointegration that happens, right? So this is one of the advantages of using 3D printed implants, because you can see here that, once you have this supply all the way, now you have an opportunity for osseointegration to happen over a period of time, right? So these are some of the advantages with customized implants, right? You have a unique fit, you conservative approach relatively, you do minimal bone removal, whatever is needed. This is how the overall process works, right? Many of you feel like, 3D printing, how does it work, right? It's a very mature technology now. It's been out there for last 20 years, especially even in aerospace now, planes, they have parts that are 3D printed. And in this, it's not just like powder being, there's 100,000, almost 1,000-degree temperature. These are electron beam melting. So it creates a melt pool and creates an argon and a vacuum chamber in which this entire parts gets manufactured, and it's a very matured technology now. So you get almost 100% solid part when you get the final implant. Some of the examples, I talked a lot about the hip. I'll just quickly go over some of the examples of the arthroplasty in other areas. So, in shoulder, for example, when you do reverse shoulder, you have hard time finding that main axis for the reverse shoulder, right? So you create this simple guide that allows you to create your first axis, and then you kind of build upon it. So these are some examples. Revision of a revision, where you don't have any bone stock, what do you do, right? That's when, while you can use a bone graft, these are other alternatives where you can use a custom augment kind of a thing for this. PSI for knee replacement has been around for long, and still if you look at Australia, about 10% of the total knee replacements done today are still using PSI blocks, because you don't have to go through this whole tracking and locking and all that. So there are still advantages where you don't have to do IM canal violation. You don't have to drill the hole on the femur. So these are still out there, right? And especially when it comes to complex revisions, right? So here's a case of an orthopedic surgeon himself who had this deformity, right? Where there was a fracture, and then what we did was we did 3 scans at 180-degree full extension, and 30-degree flexion, and then another 60-degree flexion. And we were able to kind of track how the patella would look like and what it should be from both the sides. So now we were able to create an implant that would perfectly fit and match where the patella needs to go back, right? So it's like recreating what the anatomy should be, right? And in foot and ankle, for example, there's a total talar replacement that happens where if you don't want to do the arthrodesis, these are other options wherein you can put the titanium 3D printed implant and kind of have the patient get that motion. Again, we don't do any design. We just mirror the nature. We take the good side of the talus, mirror it, and then put that implant in there. And then there are cases where we also have done locking screws and things like that for foot and ankle. So these are some of the examples. This is one of the first ones that we've been working on, where we have a total ankle replacement which is customized for that patient. So again, we take a CT scans and then we create a total ankle that is specifically for that patient. I think, so that's more about the 3D printing. The world is moving more and more towards virtual reality and AI, right? So I just wanted to share a little bit about what is happening. So this is a lab that just got inaugurated this weekend at Sparsh Hospital in Bangalore, where they have a 3D of that real patient where they operated yesterday. And that 3D model, the surgeon is able to look at it in the VR and really able to understand. So these technologies are, no longer available only in the developed world. We also are getting developed world, and we are very happy to have surgeons who are excited to adopt these technologies and kind of leverage this. So this is the 3D surgical AI lab that at Sparsh Hospital that we launched. With that, I want to thank you for giving this opportunity, and future is digital. So cost of, say, a 3D printed model would be 7,000-8,000 rupees. If it's a guide, which is a medical grade, where you have to use it for drilling or cutting, that is in the range of like 15,000 to 20,000 rupees. And then if it's an implant, that really varies depending on the size, but that can be, say, from 1 lakh to 3 lakhs, depending on the size of the implant. Yes. Yes.
So there is a company, Orthotech, is also working.
Yeah.
I'll show you certain things. So these are in the realm of experimentation at the moment, and they are coming up with something new. So we have done few cases, and I'll be happy showing you. So there was an implant which he said he'll charge 2 lakhs. But then we said that, देखो बाबा अगर तुमको अपना ये product ठीक कराना है तो अभी कम लो. So he ended up giving us for 95,000. So as far as cost is concerned, because it is really something very new,
Yeah.
and we doctors can really be very bargain कर सकते हैं उसमें.
So
Thank you.
we are doing printing at 2,500, provided the CT scan to give you the models of the patient size. So he is charging more, but we don't charge. But that is the thing which we have in our unit. So any models, anybody having anything, get CT scans to on a pen drive, I'll sort it out.
Yeah, but they're also designing implants and
Yeah,
things like
they'll
that.
do it. Yeah,
That's a little more complicated.
complicated.
Yeah.
Yeah.
Okay.
Now we have Anand Shankar, I suppose. Something new.